We can bookend the panel. All right, so we're going to get started. We have one more panelist, and I very much hope that she will make it here. But I see our time is already ticking down. So I'm going to get us started. I'm Susana Fried. It's really great to be here. I'm really excited to be having this conversation in a context where everybody's been saying we need to have this conversation. So here we are having this conversation about how do we do cross-movement work and how do we do that in the most conscientious and respectful ways. I think Nana quoted Audre Lorde saying, "The master's tools will never dismantle the master's house." I think that's true. But the Audre Lorde quote that I want to use for this session is, "Your silence will not protect you." And for me, when we talk about what it means to take deeply to your heart, what it means to do cross-movement work, for me, that's about understanding that silence doesn't protect any of us, even when we might think it kind of gives us protection and not somebody else. So that's my quote for the day. So I will introduce each panelist by name when it's time for them to speak, and I'll let them introduce themselves. Everyone has been asked to speak just for 5 minutes to give some comments so that we will hopefully have plenty of time for conversation. So with that, let me turn this over to Luisa Cabal. Luisa.
Thank you, Susana. I am Luisa Cabal, and I work at UNAIDS in Geneva, and I lead the team working on gender and human rights. And I'll talk a little bit about myself as I give some introductory remarks. I think I'll just be very brief because I do think we want to engage in a conversation. I think the question I want to pose to you as you reflect on the day-to-day is like, how can UNAIDS facilitate the efforts that you're all engaging in? So I want to say, well, how can the UN really help us? And I wanted to share some of the things that we have been doing at UNAIDS to see what is it that we need to strengthen, what efforts don't make any sense. And of course, so let me just share that you just heard that the UNDP launched the supplement to the Global Commission report. So one of the things that, of course, we have been doing for the past years is promoting the findings of the Global Commission around the negative impacts of criminal law, how law could be a tool in creating enabling environments, but how criminal laws and punitive laws are also violate human rights, but are also impeding our ability to meet the SDG targets and ending AIDS by 2030. So some of the other things that we've been doing at UNAIDS is, denouncing the overuse of criminal laws, but also working in emergency responses when actually the law in practice is misused and it has people are prosecuted and it has terrible impacts. We also provide guidance to governments, and in many cases it's because of alerts of civil society like you that tell us this is what's being basically that this is the bad law that is being developed in Parliament. Please help us out. So providing that assistance to governments and guidance when possible, sometimes behind the scenes, sometimes more upfront, is one of the roles that we've played. But most recently, and this is where I share a little bit of my background. I came to UNAIDS 3 years ago, but before that I worked for 16 years in a legal advocacy organization working on sexual and reproductive rights globally. And a lot of my work was around reproductive rights, denouncing the negative impacts of some laws, punitive laws, and some of them criminal, like abortion laws. And what I felt at those years was really the impacts of our silos, of working on silos. When I worked with the HIV community, in Chile in particular, documenting coercive sterilization of women living with HIV, we worked on advocacy around that, but I was always having the push. There's a lot that we need to do on reproductive rights. There's an HIV movement. the HIV movement can take care of this issue. So I felt the struggles as you try to, you find the connections. We had a framework that had, and you have the human rights framework that integrates and gives us the connections, yet we know how the demands of our own struggles push us into working in silos. And that's why 2 years ago, we worked with the Office of the High Commissioner of Human Rights to try to build on a lot of the efforts that civil society had been working on, and many of you are in the room, around making those linkages and breaking those silos. And we came together in Bellagio with OHCHR and brought the UN and some partners together, and you'll hear, and we can reflect more on that, around what had been some lessons learned from our different movements, and what were the possibilities of working together, knowing that it is challenging, and we can unpack some of those challenges, but also talking about the opportunities and what Susana said. Silence, is silence an option? And what does it mean to stand for each other? And so with that, I think that what we have been trying to do is how do we follow up on some of the recommendations that came from that meeting? And we can share some of that. And part of that project of how do we follow up is how do we support your efforts in making those linkages? And let me, one of the recent things that we did, one of the key recommendations was around how the UN, working with civil society, can guide the legal community, and in particular, those developing laws, but also applying laws, in having human rights guidance that allows us to push back when criminal laws are being overused or misused. So we hosted a meeting, we supported a meeting with the International Commission of Jurists and OHCHR, and so that's one of the threads that we're trying to move forward. But I'm here open for you to tell us what else could we be doing. I'll just also end with a quote that I heard this morning when I was at the conference center, which is that it seems we had also a whole day discussion of Accountability International around criminal laws on Sunday, and it's exciting that we're having another full day of discussion. And it seems like we're seeing the connections and we're seeing the linkages, and we all want to work on those. So we're building that vision, but as I was reminded today by someone in a panel, a vision without action is just a dream, someone said. So I think the challenge for us is how it's a challenging vision, but how will we collectively turn it into action? Thank you.
Thank you. Thank you, Luisa. And I should just say, for your ease, we'll have the speakers speak in the order that they're listed on the program. So with that, Ricki, please. Okay. You have one. Okay.
Afternoon,
Take
everybody.
it away, Ricki.
Thank you so much. I think I'm going to share just a little bit in terms of what we are doing, and I come from AIDS Accountability International, which is now moving into Accountability International, and our work is essentially just focusing, I think, on the theme of today around galvanizing a very critical mass behind use of criminal laws. And we have a project within the organization called Challenging Criminalisation Globally, which part of the partners are yourselves as CREA and the Global Health Justice Partnership, even the UNAIDS in itself, who've come on board. And with that work, what we're trying to do is to, like I think Luisa was rightfully putting it, be able to buffer those particular gaps that exist in all the work that different partners as well as key stakeholders are doing to challenge criminalization around the globe. So the work that we are doing under the CCG project in itself connects together Latin America, Africa, and Southeast Asia in itself as the three regions in which we want to push for these three huge campaigns that bring together persons that are persecuted and criminalized along the lines of identity, of expression, of morality, as well as bodily autonomous choices that persons make on their bodies. Particularly, they're looking at choice of abortion for women and persons that are able to fall pregnant. And just yesterday, we had a Challenging Criminalisation Globally pre-conference, which is our second one. So it's ongoing work that we began in 2016 at the then International AIDS Conference that was in Durban. and looking to bring together key stakeholders just the same way that we convened here, to continue exploring ways in which we can be able to connect all the work that we're doing, because criminalization of HIV exposure and transmission, we know for sure that it is not necessarily segregated to just HIV. It also then further penalizes and criminalizes individuals that are already vulnerable communities, that many of them are target communities insofar as interventions for those vulnerable populations. And as such, we felt that there was something that was missing insofar as ensuring that criminalization was challenged, and there was a pushback at criminalization in a very holistic sense, where we aren't necessarily making advances towards, for instance, decriminalizing sex work, while on the one end we understand that there are individuals who also have differential identities, much like we understand that there are trans sex workers, there are lesbian sex workers, there are heterosexual sex workers, and how all this is a way in which various governments continue to police and regulate bodies of individuals. But beyond that, I think as an organization looking at how this further compounds the well-being, the health of these particular communities of individuals. And as such, the work that we're looking at is working to push towards a public health approach towards criminalization, and looking at how there is an extra burden that is placed on the system when we continue to criminalize certain populations that we make even more vulnerable. We throw them behind bars, we incarcerate them, and with that, it makes it much more difficult to be able to bring them closer to HIV services, treatment, and even care. So looking at it from that very angle, we've looked at bringing together various individuals that are challenging HIV criminalization of HIV exposure and transmission, those that are challenging anti-sodomy legislation, those that are pushing back at criminalization or invisibilization within the legal framework of trans diverse persons and individuals, and looking at how we can be able to provide a platform for strategy around how we move and push as a movement than as siloed individual movements or individual communities. Because I think criminalization affects most of us all in similar ways. A lack of access to services, you're looking at access to healthcare specifically, a lack thereof towards social protection for individuals who are vulnerable to abuse by police officials, by service providers, even in service provision points. And the project in itself has now evolved to the point where we want to subgrant to some of the partners in the 3 regions that we're going to be focusing on, for them to be able to devise very contextually specific campaigns that could be able to lobby some of the government and leadership in those particular 3 regions to be able to understand criminalization as not just impacting individuals, but essentially the communities as well that they come from. So I think I'll leave it at that for now.
Thanks very much, Ricki. Oriana, and please introduce yourself.
Yes, my name is Oriana López. I come from Mexico. I'm the executive director of Balance. It's a feminist organization based in Mexico, but working national, international, and regional. And we are, as a feminist organization, we work from feminist values and we work with the feminist movement, but we also work on specific issues. We work on HIV related to women. We work on abortion. We have an abortion fund. And we also work on adolescents' autonomy. And there are several ways that mix together, and then we build bridges within the movements for women's empowerment. And I think one of the things that we're facing now is how do we fight back this idea that criminal law is going to protect both women from HIV and also adolescents from getting married at an early age. And those are things that we are challenging in the way that how coming and having the experience from the abortion movement, we know that the state is not our friend, and that several times we need to protect ourselves from the state and from the criminal law itself, because it's not acknowledging our human rights, and it's sometimes really damaging for women in particular. So coming from that, and it's a push from the feminist movement, what's happening both with adolescents and both with criminalizing HIV, that how do we make them see this incoherent speech? Because for some issues we can see that the state is our enemy or that we need to protect ourselves from them. But on the other hand, we want to use protectionist laws. And then how do we, me is the part that we need to empower the people, and we need to give the tools to women and girls and work from there. I also work in RESURJ. I'm part of a feminist global alliance from the global south mainly. It's called RESURJ, and we work especially at the UN, and we're trying to see also like what are the several sexual rights violations that there's like globally a push to have these criminal laws to protect us from this this violation, and how that is not effective, and how can we have more and more evidence. I mean, we already know, and of course we're working from different areas, all of us, and we know that it's not effective, but somehow we keep thinking in a naive way that these criminal laws are gonna do anything for us, and they're not doing it, and they're impacting mainly women. Women are, at the end, are the ones that are most vulnerable. We see it in abortion. It's every woman from every class and every sphere is going to have an abortion probably, but the ones that are in jail in Mexico at least, and I know that that's true for most of the countries, the women that are in jail for abortions are the ones that have the least resources that they can available for them. So we are putting in jail the most vulnerable women, and that's true for anything that has to do with criminal law. The people that are in jail are not necessarily the people that are actually stealing lots and lots of money. It's the people that don't have money, they don't have a way to have better lives for themselves, and then they have little, like small felonies, and we have jails like just filled with people that are deeply marginalized, that are racialized, that are very poor and without any other means to get their lives. So we need to work together, and that's a way that we are improving. Balance has been trying to move, to build a bridge between the feminist movement and the women living with HIV movement, and how can we work together and connect better in a way that feminist movement is actually aware of the needs of women living with HIV and are pushing for those needs at all the levels, but also how can we also learn and directly understand what are their needs, and so that we don't come up with these ideas that are protectionist, and we're not hearing from them how these criminal laws are affecting them directly, because that's the evidence that in the criminal law you're going to see. The evidence is that the woman gave it to the child and given birth or during pregnancy. It's very rare that we're going to see any other criminal laws. And even if they push the partner into jail, like why would you want your husband in jail, even though the HIV was transmitted or whatever? Like, what's the good? How can we center on repairing the damage for the woman in general, or for the girls? How can we empower adolescent girls to have options and other ways of living that is not only through marriage that they can survive or that they can improve their lives? So that's what we are trying to do.
Thank you. Nthabiseng, over to you.
Hi, so I'm Nthabiseng from the AIDS and Rights Alliance for Southern Africa, ARASA. Now, ARASA is a partnership of over 115 organizations in Southern and East Africa working on a human rights framework for HIV, TB, and SRHR. Now that is quite a big and huge statement, right? 115 organizations, HIV, TB, SRH, human rights, right? Now there are 5 factors we realized in that, is that as ARASA, our position is to build these bridges between different movements, between different organizations, between different sectors that will not necessarily come together on a normal day, right? And what does that also mean is that we have 115 partners with very diverse issues. Some are looking at HIV specifically, some are looking at LGBTI issues, some are looking at sex worker issues, some are looking at people who use drugs issues. But in the context of this conversation, what is very clear is that all of those partners with the various issues are all affected by criminalization somehow. Because each and every country in the world criminalizes some aspect of sexuality. So therefore, we are all affected by criminalization. And if you throw HIV into the mix, then we are all potential criminals one day, right? And in that instant, we also realized that we are working in silos. So what ARASA is doing is try to connect people in order to start this movement on human rights and HIV in Southern and East Africa. And at the same time, it's also having an analysis of the law, realizing that each and every law, criminalizing law that affects us, is drafted on the basis of morality. So this is about control of bodies, what kind of bodies you have, what do you do with this body, and what do you do it with, and if you throw HIV, then why did you do that with that body, right? So we then need to look at this partnership and say, at the end of the day, this is about bodily autonomy and it's about agency. What do we do about that as a partnership? Yet we realized that in creating these bridges, the partnership itself, there was stigma between the different groups, right? You realize that the women's organizations actually did not like the sex workers. You realize that the LGBTI people wanted nothing to do with the people who use drugs. So you had this entire hierarchy of oppression, and of course at the bottom of the hierarchy was people who use drugs, because all of us would look at them and like, why would you do that to begin with, right? So then that sort of forms, a lot of problems for the partnership, because as a partnership, then you need to be deliberate, clear, and explicit on your position as a partnership, that we believe in the decriminalization of all these issues. If you don't like it, you can leave. If you need our help, we'll also offer capacity strengthening that you may increase your knowledge around that issue, right? So that is where the building bridges come into place. But also, it gets to a place where we need to understand that most of these issues are systemic and they are structural, right? So we can't just say this is about HIV. This is beyond HIV. This is also about human rights. This is also about health. This is also about money. This is also about socio-economic issues. This is also about economic equality, because why do I have access to healthcare and you don't? What is causing that, right? I was in the TB conference yesterday, and the conversation that is really picking up right now is around TB catastrophic costs. That patients should not have catastrophic costs related to TB. And the solution is also here, because it says we need to give social protection to patients, or like money, so that they don't incur that cost. But what is missing from that is that there's a systemic issue here. There's a reason why we have these catastrophic costs, because the health system itself is messed up. And we can't fix anything unless we fix the system. Then we're going to keep giving people these social protection. So that's what we needed to do at ARASA, to ensure that people understand that our analysis can go beyond HIV. And once it goes beyond HIV, then that's where we see the intersectionalities and the links between the different movements. And we also realize, hold up, this is about morality. But you know what I mean? Like, the morality it's affecting us differently, because we had a workshop with women living with HIV and with sex workers, and the women living with HIV were like, actually, why are you not a prostitute but a sex worker? And the sex workers came and said, no, a sex worker is somebody that, offers sexual services for money. A prostitute is just a woman that sleeps with a lot of people for free. And everybody's like, oh, that makes sense. Yeah, I get it. But you need to then come in and say, hold up, no. In the position of you defining yourself, you cannot then also provide stigma for another woman, for a woman who chooses to explore her sexuality, So those issues then come up a lot in a partnership, and you then need to really be explicit in where you stand as a partnership. And once you've done that, then you include other stakeholders, such as members of parliament, such as national human rights institutions. And I think my time is up. I can speak about that another time.
No, but thank you. Thanks very much. And I think, everybody is putting a lot of issues on the table that we will then have a chance to discuss. So thanks very much, Nthabiseng. Niluka.
Thank you, Susana. So my name is Niluka, and I'm from Sri Lanka. I am also from the organization called Youth Voices Count, which is a regional network of young LGBTQ+ people in Asia and Pacific. It was pretty interesting when she said, like, the hierarchies we've built up in our community, in our advocacy around who's on top, who's in the bottom, and mostly people use drugs at the bottom. But interestingly, we sit down here and we make the divisions, but the constituencies that we work with, they actually have no divisions. There's a whole lot of young gay men who use drugs, and they would even not identify themselves to be drug users, because that's not the identity they always go with. Or we have a lot of young gay men who are sex workers and drug users and living with HIV. None of them have made this division. Their identities are together, and we in most of our work we try to make this division and create hierarchies. And I think, especially in terms of cross-movement building within our constituencies, it's quite important to understand that at the end of the day, it's not the statistic. At the end of the day, it's the person that really matters. And the person does not identify with one community. They might not even identify as I'm gay as the first thing. They would understand as I'm a young person who has a lot of dreams and things that I want to achieve but the world does not let me achieve them because of laws or policies, and they may not even know these laws and policies are existing. And that's where, as a regional network, that we really want to address how we build up these, how we build bridges between these movements, and especially among our constituencies. Our network started as a network of young MSM and young transgender women back in 2010. In 2015, we thought, hang on, this wording is not going to work out, so we changed the language to young gay men and young trans people so we can bring in young trans men. And in 2017, we again realized, look, it's not simple as that. We cannot categorize people, so let's go LGBTQ plus young people so we have enough opportunity and space to bring other young people in. And also thinking about the legal issues that we face at the country level. You know, one, as young LGBT people, our sexual orientations are criminalized. If we also use drugs, that's criminalized. If we also do sex work, again, it's criminalized. And in many cases, if somebody can prove that you have intentionally infected somebody else, you can still be criminalized. But at the same time, we face another challenge when age of consent comes in. Like in my country, Sri Lanka, age of majority is 18, but you can legally give consent to sex when you're 16. But when you go to a doctor and ask for a HIV test, they're like, hang on, you are a minor, get your parents here. And they're like, no, I can still give consent at 16. Now, if you, I think I'm correct, but Justin, correct me if I'm wrong, in a country like Philippines, your age of consent to HIV testing is around 13 or 14, but you can't provide, you can't have sex until you are 18. Now, that's like a really shitty situation. You have services available, but you can't access because you are not technically supposed to have sex. So this is, I think, where we really need to bring people together, young people, as, you know, we are not homogeneous, we are so heterogeneous in our nature. But actually, when you look at right to health is not only having access to health, it's not about medication, it's about your well-being physically and mentally, and that engages and involves a whole lot of things. It's about your right to food, it's about your right to family, it's about your right to hygiene. And when we consider and only promote your right to HIV testing, and our constituents is like, you know what, that's the last thing we want. I need to get my education, I'm thrown out of school. For young trans people, it's my hormone therapy, and you're not talking to me about it. It's about my identity documents, you're not talking to me about it. But for us, I think that's where we need to make it more homogeneous to all young people. This could be me today, but this could be you tomorrow. It's also about your right to health. What does it mean to you as a young person growing up about your social protection? Is our government, like for instance, Sri Lanka, the government has been cutting down the health budgets over the past few years, the national health budget. And that is right to health. You know, we need to bring people together to talk about it. It's not only key populations, it's all of us. I'm just going to stop there, and later on I can talk about some of the partnerships that we have actually built up to address these issues, but I just want to start the conversation with that.
Thanks very much, Niluka. And I think in particular, I really appreciate the very explicit reference to criminalization of adolescent sexuality, because I think we often forget to put that in there kind of as a specific issue of criminalization. So thank you very much for that. Jaime, over to you.
Hi, I'm Jaime Todd-Gher with Amnesty International, and I'm so excited to have this conversation because we've been focusing on these exact issues for the last 7 years, and there's just more enthusiasm around this than I've seen in the past, so this is great. We started our project in 2012, and we very intentionally, framed the project as criminalization of sexuality and reproduction. And we did that to try and show the linkages between the issues. We focus on abortion, sex work, consensual sex outside of marriage or adultery, HIV, conduct during pregnancy, same-sex intimacy, the whole range of issues, also adolescent sexuality. And we think through the criminalization frame that we can also show how we're all being targeted and punished for similar things, for having non-normative identities, for having sex that doesn't fit the heteropatriarchal norm, for being immoral, and for challenging gender roles. I think by showing that we have a common oppressor, we're hoping that it brings more people to the table, and it's forging this intersectional analysis that really needs to happen. You know, some people have mentioned it here, but also in the last panel about, are you really addressing criminalization in someone's life if you just focus on, for example, HIV? I mean, if it's a woman who's also selling sex, who is using drugs, who becomes pregnant, who needs an abortion. I mean, you can see if you just enter at one point, you're not doing anything really to uplift that person and free them from this state-sanctioned punishment. This panel is supposed to really talk about how do we bridge the divides, and one rally call I want to bring to this group and to this conference is that we must demand a feminist lens to this work. I mean, all too often you see issues that relate to women, and I use a very broad definition of women, and gender nonconforming people just fall by the wayside. When women are, you know, predominantly impacted by HIV, and we're not talking about abortion, that's a big deal. And it's just as important. And so I really hope that even in our own circles and our own organizations, that we can continue to demand this feminist lens. And another key point I wanted to make is that we have to think about how we're going to bridge this feminist fault line, which we've really, you know, come to understand that, you know, women's rights issues weren't even recognized as human rights issues until we demanded, you know, the governments take seriously sexual violence and gender-based violence. And we could only do so by really calling on the state to criminalize this violence. And so to some extent, it's been effective. I mean, we haven't reduced violence, but now we're on the map. You know, these issues are taken seriously to some extent. But we have a whole swath of the feminist movement, women's rights movement, that truly believes in the transformative power of criminal justice responses. And even when you show evidence that this isn't actually having an effective impact, just the expressive function of criminal law is enough. And so I think until we bridge this divide and we make some connections and come to some agreement on when it is legitimate for the state to intervene in our lives and in our bodies, we're still going to be held back in this work. So I just put that as a point that I hope that we can discuss. Thank you.
Thanks, Jaime. So with that, I just wanted to mention a couple of things that I heard kind of running across, right? And one is context is everything. If we don't actually look at the economic and political context, then we won't come up with the right solutions. And, you know, I must say, for somebody from the U.S. living under an increasingly authoritarian regime, that has never been clearer to me than it is right now. So I think that kind of issues of economic justice and political justice are really important parts of this conversation. You know, to me, the second, and I think this has been implicit in what virtually everybody has said, is that, you know, we may not see the connections, but the folks who want us to go away, they see the connections. Right? They understand that we are all the danger that they want to get rid of. And, you know, if only to be effective in response to that, we really have to see those connections. And the final point is, and again, I think almost everybody touched on this, you know, this idea of intersectionality is very real when we think about it in our own bodies, right? I'm not a lesbian with this arm and white with the other, right? Right? I am a whole person, and I carry all those things in me. I carry my privilege, and I carry my, you know, the places where I don't have as much privilege. That's all of me. And so that when we think about intersectionality in that way, I think it makes it really palpable and actually then a really central idea to the work of building bridges, because then we see it's not somebody else. It's some other realm of us. So with that, and also let me thank all of you for, actually you all spoke for under 5 minutes. I'm really super impressed with that. And with that, let me open it. Do we have folks who can carry mics around? Sorry.
Do you guys have no?
And if you could please introduce yourself, and also just a reminder that this is being live cast, so make sure you're comfortable with that.
Absolutely, thank you. My name is Andreas Berglöf, or Berglof in English. I work at RFSU, the Swedish Association for Sexuality Education. We are the Swedish member association of IPPF, the International Planned Parenthood Federation. Besides the Washington conference in 2012, I've attended the AIDS conferences since 2002 in Barcelona, and I mean I have a background in mainly working with HIV and HIV prevention, but for 5 years now I've been with RFSU and working on sexual and reproductive health and rights, and I'm very happy that we are linking HIV and SRHR, among others, much more. And this Saturday, IPPF had a pre-conference where we spoke a lot about how you can link HIV and SRHR, which I think is very important. And again, which in my mind, I haven't seen that much during the, AIDS conferences that I have attended. There has been a bit here and there, but for now, really speaking about that connections. Of course, I mean we are very engaged in the abortion struggling, the criminalization issues in different countries. But I will also like to remind about that the SRHR is more about than the reproductive rights. I mean the sexual health and the sexual rights are, I mean, linked in most of these sort of other groups or other topics. That is very important. And also I was very happy just now to see the World Health Organization having the call to action to attain universal health coverage through linked sexual and reproductive health and rights and HIV intervention. So thank you for that. I will keep talking later on maybe, but that was my comment for now at least.
Thanks very much. Thank you. And actually, simultaneously to that session, with the craziness of having very similar things happen at the same time, there was also a discussion that was explicitly about linkages between abortion and HIV. And for me, that was really a first, right? So, I mean, there's still a lot more work to do around SRHR and HIV linkages for sure, but it's been a fairly explicit conversation for a number of years now. But abortion and HIV in a very kind of explicit way, it's a much newer discussion. And I think a point someone here made is that it's not just that we need the HIV movement to build bridges with, let's say, abortion rights, but abortion rights activists also have to understand why HIV is relevant to them. So it's, it's not even two-way, it's, like a vast intersection where everything's coming together. Thank you for that. Yeah. Yes, Lynette.
Sorry, I'm just going to take the opportunity because no one else is raising their hands. I have a question for the panel, just for some thought. I mean, a lot of what we do also is donor-driven, and it's also donor agendas. Can some panel members just assist me with it? Because some of us actually receive restricted funding to work on a certain issue. We then use that money to bridge out or to branch out, as it were. I'd like to hear some views around that. Anybody? Question, thoughts? Can I hand over? Okay, that's all for now.
Anybody want to take on the how do we challenge restricted funding?
Women's funds.
So for me, is this on?
Yeah,
okay.
it's on.
The issue about silos, right? I have an issue with that because a lot of times it's the organizations that are blamed for working in silos, right? But also the other issue is that because of the nature of the funding you receive, you're then restricted to work on a particular issue and only that with particular people, right? So we're still in an environment where our priorities are made for us, is that this year, SRH is the way to go. So if you've been working on this, sorry, nobody funds that anymore, right? And now you need to then move and create the bridges somewhere else in order to continue being alive or, as an organization. And so I think it's in terms of reflecting, we shouldn't only just reflect on our solidarity and the politics of solidarity and what it means to be together, but also reflect on intersectionality within funding. What does it mean for us to actually receive funding that is set, the priorities are set by us, and it is truly intersectional, because it's very rare to have a funder that is truly intersectional and allows you to work with other groups and the groups that you want to work with.
Sure. Thank you, James.
Except for women's funds. Women's funds.
Go ahead.
Yeah,
We'll come back to you.
My organization is also part of something called the Youth Pact, which is a coalition of over 80 organizations globally working on SRHR issues of young people. We actually had a strategy meeting early this year, and one of the decisions we took as a coalition of young people and youth organization is to have a policy on funding. What type of funding are we going to accept? And especially making sure that when we apply as a coalition, that it would not compete with organizations that can work with their money at the country level. A lot of us, when we were at the strategy meeting, were discussing that, the donor-driven thing and the things that we want to address as young people are actually not what donors want to hear. We want to, we had the MSM pre-conference yesterday, and Adam Bourne was talking about sexual pleasure. And we always talk about sex and sexuality, but we rarely talk about sexual pleasure. And he was referring to one M&E document that he was helping to develop. And he has suggested a question about, have you been satisfied with your last sexual experience? And people are like, we can't put that. But actually, that's what really matters to people. And that's what drives a lot of people to do many things. We, as our network, did a discussion paper on young gay men who use drugs in sexualized settings, and a lot of people did not agree with us doing it because it's so controversial right now in our region. But that's a reality that we always see. A lot of young gay men use drugs in sexualized setting because of various reasons, and we don't want to identify it as a problem, but we want to identify it as an emerging issue that we need to address. When we did the discussion paper and sort of deconstruct what really goes in here, mainly it relates to psychosocial issues. It's around sexual pleasure. It's around having a partner. It's making sure that your partner stays with you. Or it's a problem with coming out, or being thrown out of the family, or actually being the only breadwinner in the family. So, and then it becomes a whole problem of mental health and what kind of facilities as people generally we have to mental health. I know most of the regions in our world has issues with that. There's a lot of stigma associated with mental health, trying to see a therapist or get counseling. So I think, it's a conscious decision we as activist advocates also have to make. And I know it's so difficult when we have about, in our organization, there's 2 of us. And, it's also a problem of, do I accept that funding so both of us can run a bit longer, or do we not? And for a large organization, it's another issue. So,
Thank you. Jamie?
Yeah, I just wanted to talk about the point about, this work, I think really before it takes off, there's got to be a lot of movement building work, engagement to develop trust, to develop shared strategies, and that is long-term work. So I think before we even, we have to address, funders in terms of intersectional work, but also committing to funding multiple years of movement building work. And that's a big ask. Not, a lot of funders will prefer like a distinct project or a distinct initiative where you can show impact in a year or 2. But what we need to do here is much bigger than that. So I think the conversation needs to focus on that. And Susana, can I just take a moment to push back on sort of this distinction between abortion and HIV and sexual rights versus reproductive rights? What's at stake with abortion is the ability to have non-procreative sex that doesn't lead to a child. It involves, people dealing with sexual violence. It's very much linked Also in terms of, if we're going to do this intersectional analysis, what are the key arguments we need to make? First, we need to, if we're going to really join forces, we need to push against criminalization of consensual sex, whether it's adultery, it's people living with HIV, it's adolescent sexuality. You know, that would be a bridging argument that we could further a lot of our causes. And the other one is consensual sex, and then the other one is bodily autonomy. And that's directly where I think abortion comes in, sex work comes in, and I would even argue HIV in terms of, you know, not having the state intervene in your interpersonal, sexual, intimate connections. So I think that we can really find the connections, and if we are going to move forward, we're going to think about these larger arguments that will bring all of us along. So I just wanted to add that to the conversation.
Thank you.
Thanks.
Are there any comments from Twitter? Okay, no. Can you bring it back there? Thanks, Lynette.
Hi, I just had one comment because I'm thinking that it's amazing, and I'm actually really appreciating this panel. It's beautiful that this discussion is taking place, especially that I was asking for it just a panel before. So I was just thinking that I see, especially with Todd, we were analyzing recently cases of the European Court of Human Rights, which are focusing on expulsion of migrants living with HIV from different European countries. And what we have noticed is a problem that arises when one uses the framework of human rights. For example, when the European Court of Human Rights is using this framework in a very limited manner. So we are talking about, you know, right to bodily autonomy, maybe right to privacy, but actually what is missing from considerations of the European Court of Human Rights are economic issues, social issues, issues around poverty. So I think that this is something that somehow, you know, this is like some kind of a threat when we use the human rights framework, which is to some extent very individualistic and individualizing, that these other issues around poverty, around economic exclusion might be kind of missing from the picture. At least they are missing from the picture in the European Court of Human Rights, actually, what's kind of scary. And I was thinking that there are issues we are facing right now, at least in some European countries, and I'm not pointing to Hungary, for example, criminalizing homelessness, which are also issues that entirely affect people living with HIV who sell sex, use drugs, etc. So issues that actually criminalize other forms of vulnerability, economic vulnerability, and I think that migration criminalization is a big thing right now across different places. And for example, sex workers, majority of sex workers in Europe are migrants, right? So I think it's also very important to actually have the migration aspect of it and poverty and economic exclusion aspect of it as present as possible. And if we can just go back to one, this is my question to the panel, actually. So if we can go back to one topic that was brought up, and I find it very important and interesting, the issue of carceral feminism and criminalization that is introduced by feminist movement.
Carceral
feminism. That was brought up
feminism.
That was brought up in a previous.
Carceral as in incarceration, right? So that's where it comes from, the idea of imprisonment.
State feminism that is introducing criminal laws to protect women in some context, but actually in some context contributes to the opposite. And I've heard at least two voices in the panel talking about, you know, how to not really use the criminal law, or how maybe criminal law usage of a criminal law in the context of sexual violence could be useful. So if you could please reflect a bit more on, you know, what shall we do with the criminal law if we actually advocate against criminalization? Like, how can we approach it?
So I'm going to take the moderator's privilege and take a first crack at that, and then we'll turn it over. So actually,
one more question.
Well, for you, of course.
I'm just
And
gonna,
Jasmine, will you please introduce yourself?
Yes, okay. I'm Jasmine from RESURJ, and I'm just going to add to the previous comment because I think so it's beautifully, you just beautifully laid out. I think so there is a limitation to the rights framework, and that's why HIV justice, the justice framework, and this is something at RESURJ we have been thinking about sexual and reproductive justice framework because of all the limitations she mentioned. And also, Jaime, I think that you used the word feminist fault lines, and where exactly do we actually ask for criminalization, and rightly pointed out by, I'm sorry, I don't remember the name, yes, about adolescents and the age of consent, and because child rights group have been asking for protection, and feminists within the child rights group have been really trapped within where do we draw the line where we want to protect the children. So even if we are willing to give the agency to women, but are we willing to give the agency to children? So this is something we have been really having really difficult conversations. So I think so those feminist fault lines, and where I think so it's time to open up to the questions that where is it right, where is it wrong, or are we really going to open up the can of worms and say no law? I mean, just putting it out there, yeah.
So,
You go.
sure. So, well, first of all, as someone who feels quite committed to the human rights framework, I don't feel prepared to give it up. I think it's really important. I mean, and I think partially that's because I've seen the framework change and expand very much over the years. And I was actually thinking, well, somebody was talking that when I years ago did a lot of work with Amnesty International. I was a volunteer leader, and I was mostly involved with doing work around getting Amnesty to agree that people who are in prison solely because they are having sex with a person of the same sex or gender should be considered what Amnesty calls prisoners of conscience, and that wasn't true at that point. So then, so then we went through many years of struggle, and then Amnesty agreed that yes, we should consider folks who are engaging in same-sex conduct as prisoners of conscience. And then we started saying, well, what about other people who are engaging in consensual sex who are imprisoned solely because of that consensual sex? And the response to us at that time was, yeah, of course, and it makes sense as a human rights issue, but there's no constituency pushing for that. And there wasn't, right? But
They were in jail.
No, I think we weren't thinking this way, right? I mean, and I guess what feels exciting to me, well, first of all, Amnesty's changed, and so that's not true anymore. But if it were, we now have that constituency. So that, I mean, to me, that's really exciting. Just on the feminist fault lines, part of the reason why women's rights groups turned to the law was because of the very powerful expressive function of the law, right? So it's kind of, at the highest level or the base level, or however we want to think about it, saying it is not okay it is not okay to beat your partner, right? I mean, and if your partner is a woman, that really was understood as not a crime or not wrong. Let me use the language of right and wrong. That wasn't considered wrong. And so we thought that getting this agreed to as a law would really shift the dynamics of domestic violence. Now, what we know now is, well, it doesn't work, right? So aside from any problems, kind of conceptual problems, and I'll let other people talk about that, but it just doesn't work. We actually heard a great presentation at the pre-meeting organized by Accountability International yesterday by Estefania Vela, who did this wonderful graphic where she really tried to take that apart and talk about how she, in the context of the work she's doing in Mexico, makes those arguments. And so one of the arguments is it doesn't work, and it's fundamentally wrongly conceived. But it doesn't work as kind of a first stop because it's in the first place, the easiest case to make, and then you can move it from there. So I'm sorry I took so long. Others, please. The problems of carceral feminism.
Of all the many things that have been said, I think one of the things is what do we think is justice in terms of like how do we put the person that was the victim of the violation in the center, and what is justice for that person? Because I think that putting people in jail doesn't necessarily mean anything to the person that was affected the most. And I think that for the states it's really easy just to make that criminal law and then just wash their hands off the issue instead of actually doing things to prevent further violations, which is what we need to do to stop. And it's true also for violence. I mean, like, I understand the part of putting the abuser away at a certain point and looking at the context and making sure that the family is going to be okay with the breadwinner away, because so many times it is a breadwinner. So how is that family going to be better now that the person is in jail? So those are the kind of things that I don't think that we are looking, and I think that more and more we're understanding that there is no policy, that it's not a one size fits all, and we need to take into consideration every specificity of that person. And I think that we have been changing in the way that we think about many things. Also sexual and reproductive health and rights and HIV, for example. In Mexico, the great idea that they had to guarantee stigma-free services was to have only HIV services. But what does that mean for a woman living with HIV? It means that she's going to come to a place where it's only gay men coming in, and the people are not understanding what she needs, and they're not giving her all the comprehensive sexual and reproductive health services that she needs. And then they also assume that she's not longer having sex, and because they are under-sexualized and the opposite of gay men. So I think that's an issue that we have been seeing how it's not necessarily in the best interest of everybody, and that it's going to take it's going to take money, it's going to take resources, and it's going to take time, but we need to start thinking holistically. And that applies also for this. I would say that we need to really reflect if criminal law for any case is actually useful. Because I think it's marginalizing people that are most marginalized already, and we're just pushing them to the outside of the society more and more. And that's the idea of criminal law. If you go to the university to learn laws, that's the idea of the criminal law: is what parts of society we don't like, we're gonna push them away through jail. Like, what? How do we think that that's gonna work? Why would that be different? Just killing people, is completely, for me, it's evil thinking, and it's stigmatizing. It's fueled by a stigma, but it's also stigmatizing further and perpetuating all the gender stereotypes and perpetuating all the inequalities.
Not to mention in countries like the US, where the prison industry is increasingly privatized, it's earning some folks a lot of money. Luisa, you want? Yeah, please.
I completely agree that we need to unpack and question this blind belief that we've had in the promise of the criminal law as in its protective function. But I also think that there are constituencies, and I was part of the Latin American movement that fought for laws around violence against women, and I do think that we need to have that taking stock of what did we achieve, but also what hasn't the law achieved, and then change course. But I also think that we need to be ready to show the alternatives. Mm-hmm. And we cannot just say, well, we built this edifice, and now we realize it does not deliver the promise we expected. So we also need to be ready to say, what is it that works? And I'm not sure that we're there, or we need to, again, we need to get together to really present the alternatives. The other issue I want to come back to is how do we walk the talk? Because I fear that we agree on principle, right, about this vision of social justice, but you were giving us very concrete examples of the challenges when you bring communities together to say, well, but the otherness comes across very, very quickly, and I wonder how is it that we're going to walk the talk? concretely and show up for each other. It is challenging, and it is challenging in this very polarized political environment. So I'm also interested to hear from my fellow panelists and others in terms of what have been a good examples. You gave us some of how we could walk the talk together.
Thanks. Nthabiseng, did you want to comment? Anybody? I know, I see that there are questions. I just wanted to, because Luisa asked.
Yeah, just agreeing with you in terms of the human rights approach. But this is an idea I have, and I'm sure a lot of you who have been engaged in this human rights activism for a longer time would be able to help us to understand it. But where the human rights framework that was coming from the ICCPR and the ICSCR back then, and the hierarchy that was established as the first generation of rights and the second generation of rights and the third generation of rights, this has a huge say. Like in Sri Lanka, we only have civil and political rights in our fundamental chapter. We don't have other economic, social, cultural rights as fundamental rights. And it specifically says that they cannot be used to file a case. Now, my question is again, do we need to consider the fact that we as a movement also need to engage in advocating that all rights are rights and that they need to be respected, protected, and fulfilled, and that there cannot be a distinction as first or second? Just for open conversation.
Go ahead, and then I'll come back to the audience.
In terms of human rights, especially in the African context, right, I have two issues, right? The first issue is that there is a possibility that human rights can be seen as something for the privileged, right? Like, what do you mean? If I am a poor woman living with HIV in the village, what do you mean by human rights? What I need is food on my stove, I need a roof over my head, and I need my children to go to school. So what do you mean about human rights? When you tell me about access to information, what does that mean? I need to eat tonight. When you tell me about access to medication, I don't care, I need to eat tonight, right? So that's the first issue with human rights, that how do we bring it to the people that are supposed to benefit and realize these rights, and for them to understand it and relate to these rights. That's the first issue. The second issue in the African context is that, especially within our regional human rights mechanism, the African Commission on Human and People's Rights, you don't just have human rights, you have people's rights, and these are the collective rights. And so once you go into that stream of rights, it's a slippery slope for human rights, right? And also universal human rights can be seen as something that is imported from the Europeans and not necessarily African-centered, right? So it becomes very difficult for you to actually talk about human rights and also people's rights at the same time. But what I believe we should do as human rights activists is to increase our tools, right? Not just speak the language of human rights, but be able to speak development and also be able to speak human dignity, be able to speak people's rights and what does it mean, and be able to speak justice, be able to speak socio-economic equality, what does it mean? In terms of medication, it's not just an HIV issue, it's a socio-economic issue. Why does this village not have medicine? What does that mean, right? So then we're able to expand these rulings. They don't just become about human rights, but also about things that Parliament and our leaders can also relate to, things about development and human dignity and security. And in my context, that's what they'll hear. When you talk about my human rights, they're not going to listen to that.
Thank you. I know there were a couple of hands up back there.
I have the mic.
Oh, you have the mic? Please go ahead.
Thank you. So Andreas from RFSU again. To Luisa, I have the answer on how we can go about with this. I mean, if we have really convinced ourselves that we want to cross these barriers and do the linkages on, for instance, on HIV criminalization with other types of criminalization, I mean, yeah, we have to put it on the applications to whatever organization, authority, we are applying for. And I guess that goes for UNAIDS and other sort of donor organizations also, because you have governing bodies or boards that are sort of deciding what your funds are going to. So yeah, you have to put it in the applications and really fight for it and make the case for it, I would say.
Thank you.
Thank you. As an initial disclaimer, I think jet lag is catching me again, so I'm a little bit punchy. I'm going to try to follow my own train of thought.
And can you say your name again, please?
My name's Kristen Dunn. So I come from Saskatchewan, Canada, where we've got the highest rates of HIV in the country, and where the entire, all of the issues are highly ghettoized, because primarily it's hitting the indigenous community and people who use drugs, right? So there's not even a lot of support coming from other people within the HIV community within that one province, because nobody wants the guilt by association, or they simply believe that's got nothing to do with me anymore. Like the gay men have moved on, for example. And then we've got all of the CBOs within the city, each doing their own thing. It was highly siloed. I came here to learn, and I find that I've also learned what we're doing right. Our organization, UNAIDS Saskatoon, decided to break down some silos, or to try. So our ED brought together the other CBOs in the city and said, for example, we all have our own funding streams. We all have, therefore, our own very limited missions. How can we surpass that subversively? We decided to go underground. We also have a very conservative provincial government who is not playing ball. How many fucks are given? This many. Nothing's happening. So, pardon the language, but that's how it is. So what we did was we started off by coming together in one room, representatives of each agency, and pretending that we were going to form one, even though we weren't. What's our vision going to be, our mission statement, all of that kind of stuff. We all got on the same page, because ours, for example, is completely governed as a philosophy and way of being in the world by harm reduction. Okay, so we wanted to make sure that, okay, you agree with that in principle. Till you actually do it, though, maybe not so much, without being too blunt, right? So we got everybody on the same page. And then from a few days workshop, we had 3 separate priorities emerge, through a whittling down process. One of them, for example, was we want trauma-informed care. So first, we formed a subcommittee. We got training for staff in each agency to get on the same page on that one topic, that one practice. Now we're training trainers within each of our agencies, not only to train our own incoming staff, because a lot of us have high turnover, but to offer services. I work in hospital. We're going to start offering services because nurses are not informed with trauma-informed care, and they're blaming the survivors of residential schools for their addictions, right? And they're mistreating people in hospital because you made choices, that's your result, why should I have to give you Narcan again, right? So those attitudes aren't going to change from outside, and they're not going to change from the top down. We have to surge up in order to change those things, and tip over their trees and cut them up and burn them. So I feel like we can each take our own siloed funding stream, but we can find our own ways of coming together and surging up in that direction. That's as far as my sleep-deprived mind can go right now. I just wanted to share that, because so far it's happening,
Thanks. I mean, I think that's a great example. I also have been thinking, and I meant to say this before around the funding question, that, I mean, it's true, a lot of donors want very narrowly restricted funding, but not all donors. And, Oriana keeps saying, what about women's funds? What about, so there are women's funds. There are community funds. There's the Robert Carr Network Fund. There's, there are folks who are looking within their own communities and saying, we actually have people with money in these communities, and we need to mobilize that money to create our own fund that will support the work that we do in the ways that we define it. So, I mean, that's not easy. It's not possible to do that everywhere. But where it is possible to do it, it means that we have the potential to create funds that really do reflect the values of working across or seeing the connections, the intersectional approaches.
Now that you mentioned
yes, and then Jaime.
The women's funds.
Now that I mentioned the women's funds, that's pretty funny.
I'm a mole. No, I mean, like, of course, I think that women's funds are a great option because they're already, like, they have feminist values and they understand the idea of, like, long-term relationship with their grantees. But I also need to acknowledge that they have very little money compared to other funders. So I don't think that those are the only funders that are responsible. I think that there are many out there are in here. But I also think that there's a lot of initiatives that are coming, and precisely because of people that can be very from the dark side, like your president, that I.
That then,
even, like, that is,
I don't even know.
It's yours. It's but
the yellow side. Say the yellow side.
Yellow side. The bad. I don't know. But I think that in a Star Wars language, but I think that it has been a spark to have better initiatives and strategies within funders working towards, like, having and fueling more and more movement building, and I think that that's amazing. And I think we need to hold them accountable for the things that they are saying. Like, for example, that she decides. How do we hold them accountable in terms of, like, really being, like, have deep conversation, have deep reflections on the different channels of funding that are coming, and what are the strings attached to the funding, and if it comes from governments from the north to the south, what does that mean, and how can we change those dynamics, because then we're just repeating the history all over again, and we don't want to keep, like, depending on presidents' decisions, because they change and they change based on somebody else's votes that have nothing to do with our countries, but are changing the way that we can work for our people. So how do we cut those strings? How do we have better, mobilizing our own resources? Because, for example, in Latin America, there are resources, but they're, like, so in, like, different, like, concentrated in the most conservative part of the society. How do we improve the work at the national level? So how can we just think about different alternatives so that we stop the same power dynamic? That's what I think.
Thank you. Jaime and then Ricki.
I just wanted to respond to Luisa. RESURJ actually has been trying to map alternative approaches to a few of the issues that we've been talking about, and Amnesty's been in discussion about producing that research. So it's very much on our mind about when you go to a legislator and say, don't do this, they still want to take action and do something. So you have to give them, a response and an action plan. I think in terms of, crossing the divides, one of the first things that we did when we started this work was to put people in sort of what felt like oppositional movements. We put them alone in a room and we said, hash it out, like, talk unfiltered. What arguments do you make that really are problematic for us and vice versa, and really just try to understand why, when people in same-sex marriage debates try to make sex and marriage about love and, happy unions, how that can be problematic for sex workers who are trying to not necessarily have sex, framed as something solely about love, just so having those really hard conversations. Obviously, we haven't come to some resolution, but I think doing stuff like that, having really honest conversations, is useful. And I just wanted to do a shameless plug for, we just wrote a book about all the intersections between all of these issues and how to see the common drivers of criminalization behind all of these things, and human rights arguments and framing to challenge these things more broadly. So please come see me. I can give you the web links, or just search Amnesty and criminalization of sexuality and reproduction. And there's a ton that we've created after years of thinking about this.
And the information is on the screen, right?
Yeah, those are the web links.
Available in Spanish.
It's available in Spanish, next year another language, and we're going to be making shorter, summarized versions that we'll try and translate to many more languages.
Thanks, Jaime. Ricki.
Okay. I think mine is in response to the question around how do we work within this restricted funding environment that often we find ourselves as organizations. And I think it often stems from just a values clarification at organizational level, one, to making sure that then intersectionality in itself is something that is embedded within the values that even funders whom you are approaching for any kind of funding are aware of what is it that you actually are striving for in order to continue to push beyond just what perhaps is a movement that you founded in. I mean, in a point in example, in terms of the work that we're doing at Accountability International, getting used to the language, we've made sure that then all the work that we're doing, one of my colleagues is here, Bob Munyati, and he's the manager on the CCG project, to ensure that then another colleague of ours who is managing the Destabilizing Heteronormativity project, for instance, there's synergy between this work internally, such that even when we go out and we're doing any kind of resource mobilization, we already put it out in terms of what is it that this funding is going to do and how multifunctional it's going to be in terms of how it will be used for various work beyond just one project or just one program that you have within the organization. And I think that is really just important as organizations, that at strategic level, when we're building our own strategy as organizations, that is also embedded as a value within our own values that guide the work that we do. And then the question that was raised earlier about carceral feminism in itself, I think we all need to really just take a little bit of a step back. One, I'm, like you as well, Susana, I would not be able to forego the human rights framework. But at the same time, I echo what Nthabiseng was saying, because when you come from an African context, the human rights language in itself and jargon is absolutely foreign. And I understand why Africans would say that this is foreign, because then it is language that we do not use. But it's important that we do a sort of norm analysis and validation, because in as much as it might be seen that human rights is a foreign entity, there are certain pro-humanity values and norms that exist in various contexts that we need to also be able to proliferate. One of them being around how, as humans, we're inherently born with dignity, and how in various spaces you can forego the human rights language and speak about proliferation of dignity, about causing no other person harm, about building those connections to an African ethos that believes in Ubuntu, others call it Botu, others call it the golden rule, that do unto others as you'd want them to do unto you. And it's way in which we continue to then be able to bring others closer with a language that they're able to understand, that they can relate to personally, that if something were to happen to me or were to knock on my own personal door, how that would be able to impact on my life. And I think we also need to interrogate the criminal justice system quite closely, because we all know how the criminal justice system, or the justice system that is supposed to be just, is totally unjust to those that are marginalized even. It continues to protect those that are privileged, those that are economically privileged. And with that, we've seen many instances of laws that were crafted beautifully with intent of protecting certain communities, and in hindsight come and be used against those very communities. So we need to be very, very, I think, interrogative, and to be really, really suspicious of the so-called social justice system, the criminal justice system, because many of the laws that, if we are to proliferate incarceration, we all know how recidivism in many other spaces, particularly in the global south, it is a thing that you send somebody into prison, they come out of prison, they hold a criminal record, they will not be able to go and find a job. Hence, they will end up most definitely or most likely falling back into a life or cycle of crime. And those are things that I think we need to be able to push back at carceral feminism based on the kind of undesirables that the criminal justice system in the current form that it is in has continued to bring more harm than good into communities generally, let alone that do we think that it could be able to protect the marginalized, when we have seen how many at times beautifully crafted criminal laws meant to protect other communities are used against those that are already vulnerable in our communities and in the regions that we come from.
Thanks, Ricki. Yeah. I think we have time for maybe one more question or comment, and just checking the Twitter feed. Okay, that's great.
Hello.
You get,
Hi, everyone.
You get the last question, or comment. Question, comment.
Hi, I'm Justin. I work with Niluka from Youth Voices Count, and I come from the Philippines. So since I'm probably the youngest person in the room, I think I am. I just want to bring like a young person's perspective into the discussion, where talking about criminalization is something that we young people are not really talking about, maybe because we are exempted from the law in a way where in my country, I'm talking in the Philippine context, if you are below 18, you cannot get imprisoned because that's the law, that's age of majority. So young gay men who are practicing homosexuality, who are drug users, who are sex workers below the age of 18, where in the Philippines, some of these identities and practices are also being criminalized. You cannot get imprisoned if you're below 18. So instead of getting imprisoned, you'd be brought to the principal's office if you're in school, or your parents are called into the picture. So this is something that's a young person's perspective into the criminalization idea. And also maybe on the importance of really countering age restrictions. Because as young people, as a young person myself, and in the Philippines, we cannot be given, if you are below 18 years old, you cannot be given a condom. And the HIV service provider or the HIV advocate who's trying to educate you on safer sex practices, who wants to give you a condom, is going to get in trouble from state authorities because you cannot get that condom. So that's something we really need to work on, I think, in our own countries. And today actually is the State of the Nation address of the spawn of the devil, also known as the President of the Philippines, who has this amazing drug war, where he kills everyone randomly, and anyone who uses drugs is a criminal of the state. And one thing he said, one thing I'm learning right now working with Niluka and Youth Voices Count is the interlink between drug use and gay men and other LGBT identities, where many LGBT identities are prone to substance use because of social barriers and all these minority stress. And in the Philippines, and maybe in other countries as well, this interlink between drug use and LGBT identities is going to bring you more in trouble with this criminalization laws. So that's one thing I wanted to share. Thank you.
Thank you. You know, and I was just thinking as you were talking that if we're looking for some of the places to walk the talk or have really concrete examples, I actually think thinking about who can be criminalized for having a condom is another one of those issues that allows us to really see linkages across issue areas. Whether it's because you're young, because it means you will be assumed to be a sex worker, assumed to, right there, I mean, there's a whole, you know, in Washington, D.C. in the U.S., condoms are used as evidence of engaging in sex work. So I think it's, you know, it's useful for us to think, again, in really concrete ways, what are the things that allow us to have that, an analysis that does actually bring issues together, but does so in a way that's that's concrete, that makes sense, that you know, that in very active ways can bring movements together. So we only have about a minute and a half left, so I am going to give the panelists time for one last comment, and then I have a couple of announcements to make. So Luisa, maybe we'll start with you and go this way. Quick comments.
I think my comment is just plugging an opportunity, a tool for advocacy. Someone mentioned that today there was a call to action that was launched. It has a part that calls for amending harmful laws and policies that create enabling environments to support SRHR and HIV needs. So again, let's hold accountable those agencies that develop this to then push governments to actually amend those laws. In a similar way, there's a joint UN statement signed by 12 agencies. You find it in WHO or UNAIDS website. Around eliminating discrimination in healthcare. It has a section around repealing laws and policies, and it lists reproductive health laws, sex work laws, so please use them in your advocacy in your countries to push the UN to help you in law reform efforts.
Thank you, Luisa. Jaime.
I just wanted to quickly invite people to engage in Amnesty if you think it's helpful. We really want to partner with activists and allies on this work, and we've developed training materials. We want to, do capacity building. If you want to learn more, we want to learn from you. And Just, you know, I think the more people we can draw to the table around these issues, the stronger we'll be. And thanks for coming.
Thank you, Niluka.
I just have a question. So now that we are finishing this, close to 134 young people have been infected with HIV. Close to 50 has already died because of AIDS. So what can we do really to stop this ASAP? Not waiting till another 12 years till we come to 2030, but what can we all do ASAP to stop this?
I just want to respond to the last comment there that young people are not really interested in criminalization because they can't get incarcerated because they are young. And I'd just like to say that incarceration is not the only negative consequence of criminalization. Criminalization means that you are not protected by the law. Criminalization means you do not have legal protection. Criminalization means you can remain invisible because if the law don't like you, why would we want to listen to you? Criminalization leads to stigma and, of course, limited access. So this is something that young people should be interested in. And lastly, join us throughout the week, booth 520, Human Rights Networking Zone. Thank you.
Thanks.
I have just two things. I think that many lawyers need to be introduced to the model, the harm reduction model, because I think that laws and policies can be like very harmful. So why don't we start using the harm reduction model to laws and policies? Because I think that's something that we need to start thinking about. And the other thing is that I need to say that the feminist movement cannot do things on their own and think that they can do it without people that are most affected. So for what Jasmine was asking about adolescents, I think that has to do with the youth movement, and we need to build those bridges. Coming from the youth movement, I know and I feel for that and to go to that, but yeah, that. And then shameless announce, we're having an event on Thursday. It's going to be a cocktail. There's going to be drinks at 6 p.m. It's very close to the conference center. The place is called Rosarium. We're going to be launching testimonies of women living with HIV that were coerced or forced into sterilization. Wow.
And I think mine will just be 2 points as well. It's a recommendation of an alternative approach that we can take on challenging criminal laws. And it's all, I think from my thinking, it stems from having to have conversations around economic losses to the states, to governments, insofar as sustenance of criminal laws. We know for sure how there is a huge burden on the state resources to be able to take care of many countries that have often crisis because of the fact that there are many other women who actually do not want to have children and are forced to have children when there's no abortion services made up available to them. And how even in essence we continue to see a whole lot of LGBTI migrants, for instance, migrating from areas where they are criminalized for their identity, and the kind of brain drain that many of our countries continue to lament, for instance, in different parts of the world, and having to actually come to the table and have that kind of an economic kind of focused conversation around what are the economical losses of maintaining and sustaining criminal laws, which I think many of our countries would be able to engage in. And then lastly, it's for me to invite you to our Challenging Criminalization workshop tomorrow happening. Bob Mwinga over there will be moderating the session, and that is going to be 11 o'clock up until 12:30 at E102 at the main conference center. Thank you so much.
And thanks, everyone. Round of applause for the panel, for all of you. Thank you very much. I have a couple of quick announcements. We will have a 15-minute coffee break right now. Please be back in here at 15:45 for the plenary. In this room, we will have rapporteurs' reports from the breakout sessions, a group discussion about next steps. And please, if you want to tweet, the hashtag is #BeyondBlame2018. Thank you all.